mine. What do you feel beside? I don't know where we're going.
I'm here in Burlington Hospital, and this was closed due to further investigation of professional misconduct and mismanagement. Let us see how the story goes. Hello everyone, we are Team 3 and we will be discussing about capacity, choice, and advanced directives. We are composed of 6 members, namely Dave Marvin Obligar as the client's husband, Karina Sharda as the host of the show and the client, Jingle Diola as the charge nurse, Manjeet Kaur as the hospital administrator, Jasmin Manugas as the bedside nurse, and yours truly, Diammond Anastacio, as the ethical consultant, narrator, and the CNO board director. This is entitled Expressing Wishes for Healthcare, the Right to Die Peacefully. Thank you. Here is the scenario. Margaret Bentley was a long-time nurse working mostly with patients with dementia. She was determined not to die a slowly, lonely, frightful death like so many other clients. She planned through creating a living will. She clearly stated that when her time comes, she didn't want to have any heroic measures to keep her alive. She also discussed the issue with her children fully and openly, and they agreed. Today, the 82-year-old client, who is in the final stages of dementia, is kept alive against her wishes and those of her family. Here's what Margaret Bentley wrote in her living will when she was in Compos Mentis.
I direct that I'll be allowed to die and do not kept alive by artificial means. I want my family to perform a ceremony based on our heritage as we belong to the indigenous tribe. I want all of them to be present during my post-mortem care. I hate and I do not want nourishment or any liquid in case I am on the vegetative state.
Currently, Ms. Bentley is confined in Burlington Hospital with suspected COVID-19 symptoms. She is in isolation room and is on semi-vegetative state. She is fed 3 times a day, and the bedside nurse puts a spoonful of pureed foods in which she has difficulty in swallowing. Let us see what happens.
Good afternoon, Mrs. Margot. Let's have some food for your nourishment. Miss Margot, have some of this food for your nourishment.
Husband stays outside the room, seeing her wife. He pleaded multiple times so he could see her. He approached the hospital administrator for this.
Could I visit my wife in her room even in 5 minutes? I just want to see her. I miss her a lot. Could I go near her? Please?
Hey sir, I told you many times that you are not allowed to enter this area due to COVID-19 restrictions. Could you just follow it? And you must leave here now.
Ma'am, we are old and we don't know if we see each other again. I just want to be on your side in this last moment of our life.
No, you must leave or else I will call the attention of the guards.
When visited the client and saw the scenario.
Excuse me, nurse. Why are you still doing that? What I remember that it's against her will.
But Mr. Bentley, we are just sustaining her body with nourished food. And this tube, it helps her swallow foods easily that may prevent her from the risk of choking.
The husband reacted in a loud tone.
I love my wife, and what you're doing now is against her will. You just prolong her suffering. Let me speak up to your churches. You do not know what you're doing.
The bedside nurse immediately called the charge nurse.
Hi, Mr. Bentley. I am Jingle, the charge nurse here. I know you're upset. May I ask you to come down? You can state your concern if you have anything to tell me. If you have time, then let me know. We can discuss it in private, okay?
The healthcare team and the husband had a conversation at the nurse's station.
Sir, I know you are so worried about your wife. May I know what exactly you're concerned about? Because NGT is part of continuing care to provide nourishment to your wife to promote quality of life. Does it sound clear to you? You can also refer to your doctor and how it does affect to your wife's body, okay?
It is against the will of my wife to be provided of life-sustaining interventions. What's the truth? I don't like that for her. Can't you see? She is in vegetative state. I wish I am near her side, but you don't make actions for me to see her.
I am sorry, Mr. Bentley. Hospital protocol this time, you're not allowed to accompany your wife. We do not want everybody to get infected. The restriction will help to stop the spread of the virus, okay? I hope you understand, sir. With regards to your concern about your wife, your doctor will be here any minute.
While the husband is waiting for the doctor, he suddenly called their lawyer.
Hi, Miss Manu. Miss Manu, my lawyer. I have questions. My wife is in vegetative state. Do I have the right to decide for her? They inserted tube in her mouth without my consent. It's so annoying and it's against the will of my wife, right? It seems you don't know what you're doing. Can you help me for this? Thank you.
I understand your frustration. Actually, you have a right as substitute decision maker to speak on behalf of her.
While they are talking about the husband's concern, emergency arises. Margaret had a cardiac arrest and died.
Please, I beg you. May I say my wife for the last time? Even just a moment. Our pastor will come soon as we have to do certain rituals. Please let me do this.
I'm sorry for your loss, Mr. Bentley. But as for COVID-19 protocols, patient died due to the virus. We'll immediately put her to the mortuary for cremation. You could proceed there, sir.
The family was shocked and dismayed but could not speak as they have prepared their spiritual leader to perform their ceremony for post-mortem care. This is one of the ethical conflict in Burlington Hospital and they are still investigating who is liable. Back to you, Karina.
Thanks, Diamond. We are back to the news to tackle about this ethical scenario. Let's ask their side what exactly is the problem or issue to be solved. This issue was solved after the case hearing and I have invited them here. I would like to ask the charge nurse what exactly the problem or the issue to be solved.
Live in this nursing EYM ethics, you and me. Go ahead.
Yes, I am the charge nurse on duty. I had enough time to reflect and highlight some issues that focus on respecting the rights of the clients during this pandemic. This is somehow complicated as some rules deviate due to global crisis, which may violate the client's choice. I am fully aware of the living will of the client. When she was capable to make a decision that indicates no nourishment or liquids during vegetative state and perform ceremony based on heritage. However, we did not acknowledge it due to new policy or protocol rules implemented now in our hospital, and we also have a shortage of staff. We are so overwhelmed by the crisis and very scared it may happen to us too.
What do you think are the ethical dilemmas involved here? Let's call the CNO director.
As one of the CNO board director, these are the ethical dilemmas seen between the capacity of the client's autonomy, in advance directive, the lack of informed consent, and the lack of commitment to quality practice setting. It also violates the CNO practice guideline, which states that the goal of Healthcare Consent Act includes promoting individual authority, autonomy, facilitating communication between healthcare practitioners, their clients, as well as ensuring a significant role for family members when the client is incapable of consenting. As a CNO director, I have summarized the ethical concerns here. First, the husband pleaded multiple times to see her wife but was ignored. Advocacy from healthcare team and lack of commitment to communication in practice setting is seen as this could be prevented through alternative measures. Second is the healthcare workers performed NGT to sustain bodily function. This could be also a life-sustaining intervention to promote the quality of life, but is against the client's choice. All wants to continue living and allow natural death. Autonomy over freedom to make decisions was neglected due to the healthcare team assumes she is experiencing final stage of dementia, which made her incapacitated to make decisions. Third is the value of substitute decision maker and lack of informed consent from the healthcare team maker was also missing here. Healthcare team decided to order a procedure without enough explanation and sees it as benefit for the greater good. Fourth is COVID-19 restriction hinders the client's family to perform rites according to her living will, which lacks further teaching from healthcare team regarding hospital protocol during death services in times of pandemic.
So as a group, what can you say about this scenario?
This issue occurs in time of uncertainty, so there are new rules that need to be followed, such as COVID-19 precautions. The root cause problem here is a lack of advocacy of healthcare team, and they persistently ignore of her husband's request in seeing her wife, which could be manageable through the option of virtual communication. Informed consent was not featured, but this should be taken into consideration with the help of substitute decision maker. And then meaningful communication and collaboration through the explanation of medical intervention and hospital policies should be demonstrated by health care team.
When a person who's receiving care is terminally ill, nurses foster comfort and assist people in meeting their goals of culturally and spiritually appropriate care. What do you think are the ethical values that are existing here? Could you give us a better view of it as a director?
This is a very common scenario and is hard to tackle during times of uncertainty, right? Client's choice is the major ethical value that is violated here, as her choice of dying without heroic measure was not followed. She was cremated without husband's consent. That is the worst scenario if I am in their shoes. Informed decision-making was also not seen, right? And client's well-being. How do they facilitate health and remove harm? By putting NGT? Yes, it relieves discomfort against risk for aspiration, but client's choice was not respected and informed consent was not given attention.
With you, Ms. Director. I know about this COVID-19. My family and my wife have been separated for a long time, but my concern is my wife's living will was not been respected. I am the substitute decision maker since she is incapacitated to make decisions due to her dementia. She was also cremated without my consent and we did not even allow to do our rituals.
I agree. Respect for life is violated here as they did not honor your wife's will.
Another two ethical values that is involved here are maintaining commitment to client and privacy and consent. The commitment to clients include the commitment to respect family members and significant other, which is essential in these times of uncertainty. Communication systems was disrupted between healthcare team and family member when the husband's request was neglected and no option was given.
I heard it right and realized the value of informed consent and the importance of advance directives, which healthcare staff abandoned and creates an ethical dilemma to the client's right to choose medical treatments during this crisis. Somehow we understand we nurses are responsible for our own actions and decisions that we are doing for the good and benefit for our clients and to the family. This is a lesson learned that needs to be corrected in order not to happen again.
Oh, I agree. So what are the ethical principles upheld here?
I think we are very truthful to our obligation to the point that we want her to survive.
Oh yes, that is fidelity to your professional obligations. But looks like there are ethical principles that was violated, right?
Good morning, Miss Karina and Mr. Bentley. As a physician, it is only my duties and responsibilities to give only the best and quality care for all our clients. And this pandemic, it changes everything accordingly.
Oh yes, veracity and integrity to what is right is violated. The whole healthcare team was not able to communicate effectively to address the needs of the family. They lack explanation about the medical intervention, the COVID-19 protocol, and the death care services.
I disclose that we have lapses on our part as we neglect the needs of our clients and their autonomy in creating decisions was not even supported, especially the family cultural practices and beliefs.
Oh, yes, you did not even give us information regarding what happened during the cremation of my wife.
As you could check, the ethical legal aspect scenario happened during times of pandemic. The presence of substitute decision makers should be highly focused in getting informed consent, especially if the client is incapacitated. We know that it's very hard to communicate due to limitations of pandemic, so interprofessional teams should advocate and be responsible for this. Proper assessment of clients' capacity to make decision must be undertaken by the healthcare practitioner. In this case, client is suffering from final stage of dementia and is on semi-vegetative state. She does not have the competence and the capacity to make her own decision. This is the violation of the goal of the Health Care Consent Act by CNO, which states that it includes assessing the client's capacity to make a treatment decision is the responsibility of the healthcare practitioner proposing the treatment. The doctor ordered the NGT but did not emphasize the informed consent and advance directives. According to CNO, substitute decision maker is usually the spouse, partner, or relative. The husband is the authorized decision maker when the client reaches this stage. He continuously seeks for further information as he is present 8 years ago when the client had her living will.
Globally, we are affected by pandemic, especially the death care services. I remember they recommended all provinces and territories to implement community-based public health measures to contain the spread of COVID-19. So how does your hospital cope up with this?
As a hospital administrator, we lack knowledge. These restrictions may affect the death was unrelated to the COVID-19. Regardless of cause of death care providers should be considered the use of virtual technologies, example telephone, video recordings, and video conferences in place of in-person services and gathering.
Oh yes, that's a great option. So you are now implementing this in your hospital.
Yes, we learn from our mistake.
Let's see what are the proper actions that they must do here. I guess there are various options and all are solved through proper advocacy, good communication and collaboration among the family members and healthcare team. What actions can you do here?
At the time the husband felt uncomfortable of the insertion of NGT, I think we should have asked the physician's help in explaining the procedure. He has all the authority and power in explaining the medical diagnosis and as well as the alternative options for the clients.
From the time the nurses observes the clients becoming progressively worse in condition, the healthcare team developed a plan of palliative care with the healthcare professionals, which includes the physician, nurses, spiritual leader, and ethics committee in facing with this ethical distress.
I guess your hospital should always have a meeting and debriefing about the hospital protocol and about the death care services during emergency crisis.
And I think I should also advocate for the client using social technology. You know, the moment when the husband, Mr. Bentley, continuously plead to see her wife. Well, I could relay that information and seek for approval and assistance from the nurse manager.
As a hospital administrator, we could align our hospital policy with the use of technology in communication. Through this, we could also solve the request of husband to perform rituals or ceremonies with the help of spiritual leader. If they still did not like the idea, the last resort could be the hospital ethics committees or presence of ethical mentors to address the ethical issues of heroic treatment.
Oh yes, this scenario should be solved using 5 C's: collaboration, communication, commitment, compassion to learning, and capacity of the client. The advance directives should be the top priority at the start of the conflict through assessing as a team the capacity, the competency, and capability of client to make decision which promotes client's well-being and client's choice. To be a solid ground, both legally and ethically, hospitals are obligated, as part of the Medicare Conditions of Participation and Joint Commission on Accreditation of Healthcare Organizations, to honor patients' advance directives.
Oh yes, so we should always remind 4 C's, right? And this is a wonderful session of EYM, Ethics, You and Me, regarding capacity, choice and advanced directives.